My name is Trisha Badong, and I'm here to talk to you about the theory evaluation of Nola Pender's health promotion model. Here is the overview of the questions we need to answer to evaluate this theory. Is it congruent to nursing standards and interventions? Is it empirically tested? Is it socially and culturally relevant? What are the contributions and implications to nursing? Pender's theory is congruent to nursing standards, and here's why. These are organizations that utilize HPM. WHO Ottawa Charter was the landmark policy for health promotion. Healthy People 2020 is a national effort that sets goals to improve health in the United States. USPTF is a panel of experts that evaluate and recommend preventative services. Pender's theory is congruent to nursing intervention. The next slide shows 3 examples of current nursing interventions that use HPM. NANDA determines the plan, interventions, and outcomes enabling the nurse to develop a POC. GFHP is a questionnaire used in nursing process to provide comprehensive assessment of health practices. HPLP is a questionnaire conceptualized as multidimensional to measure health promoting behavior. Pender's theory is empirically tested. Information on the next slide will explain why. Significant number of scholars and researchers have used HPM to explain and predict specific health behaviors. In the last decade, more than 250 published English written articles have reported the use of HPM. HPM is socially relevant with the current health issues we are facing with the vulnerable population and issues with global health. The next slide will show you why. Health is wholeness. It is complete state of physical, mental, social well-being, and not merely the absence of illness. It cannot be separated from one's conditions like neighborhood, social relationships, work, income, and leisure. These are all interwoven and impact health. Although major drivers of global health are government and non-government agencies, healthcare providers play a crucial role in assisting community health issues. Remember, health education is a component of health promotion. Health education is focused on the individual, while health promotion is focused on the community. Socioeconomic status is a complex concept with multiple components like income, education, occupation, social class, and neighborhood. Low economic status is a consistent predictor of life expectancy, morbidity, mortality, and health status. Global Health Agenda is all about health promotion. Its goal is to improve the health in all nations by promoting wellness, eliminating avoidable diseases, disabilities, and death. In Pender's book, she emphasized health promotion, particularly in the vulnerable population. These people are the ones living in poverty, non-English speaking person, immigrants, refugees, homeless persons, individuals with mental illness and disabilities, and the LGBTQ population. Gender equality is considered a major social determinant of health in women and transgender individuals. People with disabilities are at increased risk to chronic conditions related to complications from the primary disability. Health promotion is needed and is often neglected in both these populations. We are halfway done. To answer the question above, Pender's theory is cross-culturally relevant, and the answers are on the next slide. United States has become a nation of diverse racial, ethnic, and cultural background brought about by massive migration, creating mixed racial groups like Hispanic American, Asian American, producing cultural evolution with multiple languages, religions, values, and traditions. These differences influence how one seeks access to healthcare. Culturally sensitive approaches, according to Pender, can enhance access and acceptance to health promotion programs. Focus groups and individual interviews may reveal culturally relevant information. community priorities and availability of resources should be identified. Pender's theory has greatly impacted nursing practice and nursing research. The reasoning is coming up. The health promotion model can guide a person-centered health counseling to improve a wide range of health behaviors. Success in these interventions produces meaningful and sustainable behavior change, therefore improving health. The fundamental purpose of HPN in nursing research is to build knowledge, to predict behavior, to improve health. We should not forget the other benefits of HPN. It decreases social problems such as violence, suicide, and STD. HPN also has the potential to decrease healthcare costs in the years ahead. There are a lot of implications with the implementation of HPN. The next slides talk about the role of digital technology, the call to action for nurse evolution, strengthening empowerment to individuals and the community, utilizing lifespan approach, and finally, push for health equality. The increased use of the internet has resulted in social network communities providing instant information about health promotion, but information access may not be scientific background and should be followed up with a professional. More research is needed to document the role of technology, but until then, consider it as a tool. The nurse evolution is needed with health promotion. The changing digital scene with the persistent health inequities and the burden of non-communicable diseases create challenges to health professionals. We can create new roles in health promotion, incorporating these information and communication technologies to promote healthy behavior. Empowering self-care is the nurse's #1 priority. To collaborate, facilitate resources, and teach has become important because patients express the desire to assume more responsibility for their health. Lifespan approach in health promotion. Children and older adults need to participate in their health. Digital technologies offer many possibilities to engage all ages in promoting healthy behavior. Empowered communities believe in their capacity to change inequities and bring about change. They have a sense of caring and builds a stronger community that facilitates affordable housing, public transportation, and access to healthy foods. Empowered communities lobby and engage in policy decision-making that impact the community's health. HPN strives for health equality. Health insurance determines the amount and type of health services obtained. Lack of health insurance has important implications of health in health promotion, screening, and access to wellness programs. In summary, HPN is appealing to many nurses because it is holistic and humanistic, congruent with many nurses' own philosophy of health and nursing. The model has a positive vibe to it and reflects belief that people are capable of change. The health promotion model proposes that healthcare is more than treating disease, but creating an avenue where patients can meet their full potential. The HPN's framework integrates nursing plus behavioral sciences, self-perspective on factors like education, food, housing, income, employment, and healthcare that influences health behavior. The model is used as a guide to explore biophysical processes to motivate behavior, therefore improving health. And finally, the favorite reason why I like this model is because it's multidimensional, encompassing the individual, family, community, environment, and social health. It emphasizes the culture of health that far reaches to global health of all nations. Again, this is Trisha Badam. Thanks for watching!